All right, so I'm excited today. This is a continuation of the conversation that was last week on the podcast with Dr. Tony. So today we're going to be diving more into autoimmune disease and gum disease and just how our mouth health relates to our whole body health. So make sure you guys listen to the episode last week and let's get started. Hi, friends, and welcome to the Healthy Beyond 40 show. I'm Michelle, mama 4 and military wife, and I'm passionate about helping women get healthy from the inside out so they can feel better and live their best life. Do you feel like you're struggling to lose weight and get in shape? If you're ready to develop healthier habits, exercise consistently, and lose weight sustainably, then you're in the right place. I combine my expertise from my doctorate in physical therapy to my experience as a health coach, personal trainer, and yoga teacher to bring you actionable steps for a healthy lifestyle. No magic pill here, so lace up those shoes and get moving. So let's talk about periodontal disease. So tell us what that is, and then if it can be reversed through non-invasive ways.
Yeah, it absolutely can be. So periodontal disease is just the technical term for gum disease. It starts out as gingivitis, which is just an inflammation in the gum tissue. And when gingivitis hangs around for too long, then it can infect the deeper part of the gum tissue underneath the gum line around the teeth in what's called the periodontium. And that's just all the soft tissue surrounding each tooth. And so when that becomes diseased, when there's, again, inflammation and imbalance in the bacteria of the mouth, then not only does it cause the gum tissue to be inflamed, but it starts to impact the bone underneath it. And so periodontal disease is the biggest cause for tooth loss because as your gums start to recede from the disease, so does the bone underneath it. And so at some point, a lot of times you lose too much bone that's holding the tooth into place, and the tooth isn't able to hang on anymore. So periodontal disease is a huge cause of tooth loss. It also, because of where it is, all the soft tissue in your mouth is so absorbent and so close to your circulatory system that all of that bacteria and all of those inflammatory cells are now systemic. And so periodontal disease is directly correlated with a number of other health issues. So an increased risk of heart attack, increased risk of stroke, more flare-ups of autoimmune conditions. So Crohn's disease, rheumatoid arthritis, an increased risk of breast cancer, an increased risk of erectile dysfunction. So tell your guys out there, hey, we gotta clean up the gum tissue so that we can keep having fun in the bedroom. Diabetes, pregnancy issues, miscarriages, all of these things can be directly impacted just by having the presence of gum disease in the mouth, which is insane.
Yeah. So it's like this bacteria and inflammation that's happening in the mouth and then goes systemically.
Right.
But probably like if you're at a doctor for heart disease, they're not always like checking your mouth or for these other things.
Correct. They should be, but they're not as often. The really good ones will say go to the dentist.
Yeah. And so how do we prevent, or if you're starting to see this gum recession or things happening, what can people do?
Well, I think that just really good, solid preventive care with a dentist that you trust. I think that is first and foremost because we can catch these things early. A lot of times we'll notice the bleeding and we'll notice the inflammation before you're able to. So if you're already to the point where your gums bleed when you floss or your gums bleed when you brush your teeth, then it's already probably fairly significant and we really need to take a look. So definitely always good to have us take a look frequently so that we can be monitoring these things and catch something early. As far as prevention goes, diet is key. Having an anti-inflammatory diet, lots of antioxidants in the diet, so brightly colored fruits and vegetables. Omega-3 oils are really good. Vitamin C is a super important nutrient for the gum tissue. All of these things can help prevent. And then just from an oral hygiene standpoint, then making sure that you're brushing with a really high quality toothbrush and getting something in between your teeth on a daily basis is really key. That may not be floss for everybody. Not everybody my hands are teeny tiny. I have baby hands. And so I can get a little piece of string in there just fine. But, a 65-year-old grandpa like my dad with these big old huge meat hook hands, a little bit harder for him to floss. So I'm thrilled if he uses a water pick because it can get in between the teeth. We just need something in between the teeth to disrupt the microbiome, disrupt the biofilm on a regular basis.
Okay. Yeah. So the biofilm. So tell me a little bit more. What does biofilm mean?
The biofilm is so fun. There are biofilms everywhere. If you've ever, I'm sure this was none of your audience listening, but just in case you ever know somebody who's left a dish in the sink for too long, and after a couple of days, it gets like this film under the water, or a dog bowl that's got that film at the bottom of the water bowl, that's a biofilm. The rocks at the bottom of a pond, biofilm. A swimming pool that hasn't been cleaned in a while will get kind of the slimy, gooey at the bottom of it. That's a biofilm. So a biofilm is just this humongous community, this like living city of bacteria, which is so freaking cool. It's got like super highways and communication systems. It's these little colonies of bacteria that have all joined together and work as a unit. So in the body, we have biofilm in different places too. People will get biofilm around implants, around breast implants and tooth implants for that matter. And you get biofilm in the mouth around the teeth after a period of time. And your biofilm, if you've got an amazing microbiome, that biofilm could be totally fine and healthy. But if there are any imperfections in the microbiome, or if you're not disrupting it on a regular basis, then things get a little out of balance. And the biofilm is it's just plaque. It's plaque in the mouth. Same thing. Plaque is a biofilm. And so if we're not disrupting it on a regular basis, then what happens is the biofilm has all of these protective mechanisms. And so the more established it becomes, the more it protects itself from you getting in there to clean it well, and from your white blood cells from getting in there to properly take care of all the waste products that it has. So it's super important. It's a fascinating area of study. I don't know why something so gross fascinates me so much, but it's so important that we're just stirring it up on a regular basis. That actually keeps the microbiome in the mouth happy.
Yeah, that makes sense. I love that explanation and the comparison to other things. And so you mentioned implants and how you can get the biofilm around that. But I also know root canals are a big thing. I have never had one. But so tell us about the potential impacts of getting a root canal and maybe if there's an alternative.
Yeah, this has become a super controversial area of dentistry lately. And I love that we're able to have a conversation about it. There are still two different camps. There is the camp that says that's probably, my more traditional colleagues, the endodontists, the quote unquote normal dentists who say all root canals are fine. A root canal is just removing the nerve and the blood supply of the tooth so that you can maintain the structure of the tooth. You save a tooth, basically. It gets to stay in your mouth when you've had a root canal procedure done on an infected tooth. On the opposite end of the spectrum are our naturopaths, our functional medicine colleagues, all the holistic providers that refer patients to me who feel like no root canal is safe because it changes the microbiome in the area. And some people are noticing ill effects or noticing symptoms that pop up elsewhere in the body after they've had a root canal. Or they've noticed that after they've had an old root canal removed, that some of their symptoms go away. So what's really interesting is, and I'm glad there's discussion around it because I'm not dogmatic on either side. I don't think that all root canals are great for everybody. I think there are concerns with them because they do tax the immune system. Your body's having to work to maintain that area. And it does change the microbiome around the root of the tooth. But I also don't think it's correct for every patient in every situation to remove a tooth or, avoid a root canal altogether. I think every patient gets to decide that. And it's a very, very personal discussion with what are the risks? What are the pros and cons? So I think the answer is different for every person, and it's kind of along a continuum. But I do notice that there are some patients who notice that their chronic illnesses start after they've had a root canal. And I do notice that, especially those who are working with a functional medicine provider, that once they've had their root canals removed, or if they've had an infected root canal removed, that it's easier for them to get some of those symptoms to go away.
Yeah, and it probably goes back to everyone's a little different. And some people are just more on that autoimmune spectrum, and they're sort of the canaries in the coal mines, and some people might be more affected. So I like how you have that open approach to it, because so if someone is maybe a candidate for a root canal, is the alternative if they don't get one just to get the tooth removed, or is there something else they can do if they don't want a root canal?
If a tooth is truly infected and the nerve is truly dying and not going to recover, then the only other decision is to have that tooth removed, which really sucks. Like, that's not a fun conversation to have with anybody. It's not a fun decision to have to make. Now, it's because I think we take them more seriously in our office than in other offices. We are able to avoid some, just like you were talking about with fillings. You'll have some dentists that are more aggressive than others. And in an attempt to be kind and not make a patient need to come back, they'll suggest a root canal for a tooth that maybe has the ability to still recover and still be okay. And so we are really, really making sure that we are confident before we say, hey, you've got to make a decision, A or B, root canal or pull the tooth. Because sometimes if a tooth is just really sensitive, if it's got what we call reversible pulpitis, sometimes we can do some ozone injections and can support the body. And sometimes, given the right circumstances, it can heal and do what it needs to do on its own.
Yeah, I like that you brought up the ozone. At the one dentist, I was having some sensitivity, and he did like little ozone injections on it. So what are some like different treatments that someone might see at a biological dentist, like the ozone, or just things they probably haven't heard of?
Yeah, ozone's a big one because we use it so much in so many different things. We ozonate the water at our office. So even the water coming out of our drills and handpieces is all treated with ozone. We inject it for, like we were talking about, for sensitive teeth. We will place it around gum tissue to help treat gum disease and gingivitis. We'll blow it at the bottom of a filling on a sensitive tooth before we actually place the filling material. So we use it a ton of different ways. Other procedures that we do a lot of laser work. I have an all tissue laser. So if we can catch airway issues, then there are some laser procedures that we can do. There's a procedure called night lays where we can help shrink the soft tissue in the back of the throat. So it can help relieve symptoms of snoring and sleep apnea, which is really cool.
I did not know that was a thing, but I did know like some people who snore, like, so I had heard this. I don't know if you've heard this or if it's true, but like sometimes when people gain weight, it's sort of in their tongue or their throat. And that is why you'll see the snoring in some people.
Yeah, absolutely. And sometimes it's not even excess weight because a lot of women have sleep apnea, and it's just much easier to miss because we don't it's not necessarily because of excess weight around the throat. Sometimes it really is we just have too narrow of an airway. And there are all kinds of reasons for that. We'll have to do another episode on. Because it can start in utero with a tongue tie, not nursing for long enough. All of these things that can modern orthodontics, not now, but orthodontics, especially in the 80s and 90s, where the solution was usually if teeth were crowded, the orthodontist would remove teeth, kind of take out the teeth that are crowding and shove everything back. Well, where are you shoving things back? Into the airway. So all of these things contributed to men and women having much smaller than ideal airways, which is part of why we see such an epidemic in sleeping issues and snoring and sleep apnea now.
Yeah, that's interesting. I haven't heard that before. And I just want to ask, so you mentioned your journey into this started with autoimmune diseases, but what else can you say about autoimmune diseases and dental materials or procedures that can trigger or worsen, or if like someone maybe has an autoimmune disease and they haven't heard of any of this before?
Well, it's just so important to remember that it's all connected. It is all connected and it's circular. What's going on in your mouth, inflammation in the mouth, or a little bit of neglect of the mouth can lead to inflammation elsewhere in the body, which can trigger autoimmune illnesses for some people. And so we'll see a poor oral health implicated in an increased risk of autoimmune issues. Well, the same is true in reverse. If you're getting a flare of an autoimmune condition, a lot of times we're the first ones to see it in your mouth. So sometimes you've got inflammation, you've got autoimmune stuff going on, and it will cause inflammation in the mouth. There are a few like little rashes and lesions that can happen in the mouth that are a telltale sign of autoimmune conditions. So it goes both ways. And it's so interesting. When I was in dental school, and I'm not that old, I'm, mid 40s. When I was in dental school, autoimmune illnesses were taught to us as something that's pretty rare. And, we'd see it every once in a while, like maybe once or twice a year. Well, man, it is everywhere now. And I see autoimmune patients at least once or twice a day now. So
Yeah.
we're clearly more inflamed. We're more autoimmune. We're just not doing as well as we used to be. And I think having a healthy mouth is part of the solution, and can give us hints into what's going on in the rest of the body.
Yeah, autoimmune diseases are so rampant. And I don't know if it was 5 or 7 years ago, I sort of started with some swelling in my fingers and joints and these little nodules, and, go to a rheumatologist. They run a bunch of things. Only my ANA was positive. So that's just a general autoimmune marker. Nothing else was. And they're basically like, well, just keep coming back. And, if it gets worse, we'll give you drugs. I'm like, I do not want to do that. Like,
Yeah.
you're saying you can literally offer me nothing else to prevent this from getting worse. So I went and saw some holistic doctors and chiropractors on my own and have been much better. But my mom and her sisters are all sort of on the autoimmune spectrum. Like, they sort of grew up around the steel mill, like just those environmental triggers. And then, things we do or don't do can sort of tick things on and off. But it is so rampant. And in conventional medicine, there's not a good solution besides drugging to decrease a symptom. There is no solution to fix it. And so you sort of have to dig and try to do some of that work on your own. And everyone's so different, like
Right.
what they need to fix it. Maybe someone's more sensitive to gluten or eggs, or maybe it's, that root canal they got. It can be all these different things. So I think that's why it's a little tricky too, because conventional medicine wants us to be like, okay, this is it. This is what's wrong. This is the fix it. And it's really diving into that person and their history and their symptoms and doing a little problem solving and trying different things out.
It's real medicine is what it takes. It takes real medicine and critical thinking, which many of us have been trained out of, unfortunately.
Yeah, absolutely. And so one last little topic. So tell me a little bit, we were talking about the mouth microbiome and the gut microbiome a little bit. So dive into that a little bit more and maybe like what people can do to improve both. Are they both like connected? If we work in our gut, does that fix our mouth? And maybe like if people have digestion symptoms, like what those can be signs of.
Yeah, well, there are unique microbiomes because the environment is very different. So the environment in the mouth is going to have more oxygen. It's going to have a different pH than, say, the microbiome in your stomach or the microbiome in your colon. They're all going to be different, but they're going to have some overlap. So, yes, we will see certain strains of bacteria that can give us a clue that maybe there are some gut imbalances going on because they only show up in the mouth if there's something out of balance in the gut. So it does give us clues. Now we want to, thankfully, do what's good for our overall health is going to be good for the microbiome all over. Good healthy diet, probiotics, good bacteria containing foods are really great for our microbiome all the way up and down our gut. I would say the one thing that you could do strategy wise that we do with our patients a lot is probiotics actually do differ. And there are the probiotics that we're used to taking that come in a capsule that are best for gut health because we want those bacteria to survive, to get into our gut. And there are separate probiotics that are designed specifically for the mouth. So they come in tablet form, so they dissolve right away in the mouth because we're not relying on swallowing them. We want them to be active in the saliva. And some of them even they produce these bacteriocidins that will help eliminate some of the pathogenic bacteria. So we can be really strategic. And if we see some of those pathogens in a patient's saliva, we can actually match it up with a probiotic that naturally produces chemicals to kill off that bad bacteria. So we can really be strategic and very specific with our targeted warfare against the damaging microbiome in the mouth.
Yeah, and that sort of brings back like that saliva test you said that you do. So you're using that to then target and then alter or change. So
Right.
It's more beneficial for the client. Yeah. So tell me like, so people are from all over. So what would people look for in a dentist near them? And then also tell us about your practice. And I'm curious if you have people from sort of out of town and out of the area coming to you, because it is hard to find a biological or a holistic or a good dentist.
Right? Sometimes just a good conservative dentist is hard to find too. So we do have out of town patients all the time. We have a lot of patients that will drive in from several hours away. We have a few that'll fly in if they're wanting something specific done. Like let's say they're getting their amalgam fillings removed, then they'll fly in for that and come just stay in Dallas for a couple of days and then go back to their normal dentist at home. The best way to find the biological dentist that's closest to you is a website called the IAOMT, and their website is just IAOMT.org. And they've got a really good directory. I think that's the largest group of biological dentists. There are a couple of others, but that one is the biggest. And their directory is great because it even separates dentists based on, how many meetings have we been to? Have we gotten our extra accreditations and certifications and all these things? So you can try to discern not only who feels like the best fit, is the closest to you, but also who isn't just doing the biological thing just so they can check the box, that they're actually invested in the continuing education.
Yeah. Yeah. It is hard to find the provider, but I would definitely travel if I needed to for it because I think it is worth it. Yeah. All right. Anything else you would like to tell the dentist about biological dentistry or yourself or anything you offer?
I would say really the most important thing that I hope your audience takes away is that our bodies are designed to heal. So I hope everyone is encouraged. If I can heal from Crohn's disease, then you can heal from just about anything. It's what we're designed to do. It's what we're made to do, and we're capable of it.
Yeah, and it's giving the body the right environment to do that.
Absolutely.
Yeah. All right. Well, thank you so much, Dr. Tony. And everyone, I will have her links and the link she mentioned to find a biological dentist down below. So, all right. I hope everyone has a great week.
Awesome. Thank you, Michelle.